Hi, Dr. Bilal. Welcome to Cancun. What are your first impressions about this meeting?
Uh, well, first of all, I'm honored to be here. Second of all, I think the meeting's been wonderful. I think it's got a wide breadth of topics. I've learned a lot. It's a great presentation, great format.
Thank you. I have some questions I would like to ask you. What first inspired you to do urology? And especially, I know your interest in male voiding dysfunction. What inspired you?
When I was in medical school, I had an opportunity to rotate in urology. I loved the procedures. I loved working with the other urologists that were there. At that time, I got involved with research, and then from there, it seemed like a very natural progression from residency, then to my fellowship at Cornell, and then and now getting into research. So it's just been a very stepwise progression into it.
Okay, and you enjoy it.
Absolutely.
What about how do you manage like all these stressful situations? Because as a surgeons, we face a lot of problems and complications and maybe angry patients. How do you manage them?
I guess I don't have complications or angry patients. No, no. I think it is definitely the hardest part of the job. I think sometimes I joke with certain procedures where I tell the patient the easy part is doing the procedure. The hard part is managing your expectations. I try to do my best to preempt as much as I can. So when it comes to surgical procedures, I try to have conversations with patients to try to set the expectation. But sometimes you can't prepare for everything. And I think at that moment, what I realized is, try to stay as calm as you can, and try to take a deep breath, try to wear their shoes, and try to figure out what they're really asking for. And that's that's the best you can do in those situations. Sometimes there's not a lot you can do.
Great advice. What about, can you mention to us and the audience, like by 2030, maybe mention 3 innovations in the field of overactive bladder or male voiding dysfunction?
I think in male voiding dysfunction, I think we're going to see lots of innovation. I think we're already starting to see innovations in terms of the way we're managing enlarged prostate. For example, it's been forever that we're doing medications, and then you go on to a procedure. But now with these innovations of new stents, almost reversible procedures, I think we're going to see a paradigm shift. I think the next shift we're also going to see is conditions like detrusor underactivity, where for a lot of patients we tell them, you got to catheterize or you got to live with a catheter. I think there's going to be new innovation for that as well. I think when it comes to our existing treatments, I think we're going to see exquisite safety coming in that direction. And I also think there's going to be hopefully a push in diagnostics. We're already seeing that in terms of there's home-based applications for Euroflow. So I think we're going to see more in that arena as well.
Okay, very interesting. What do you do besides or apart from being a urologist? What did you enjoy in life?
Other than being a full-time urologist, I spend my other time being a full-time dad. So
Okay.
I've got 2 daughters, one's 7, one's 8, and basically spending time with them. We go bike riding, they love gymnastics, they love the park. So that's my other full-time job.
Okay, thank you very much for this interview, and we are going to see your lectures tomorrow morning.
Well,
Thank you.
you.